Hi, I'm Dr. Lisa Bradley. I'm the Director and Assistant Professor of the Master of Science in Health Informatics program here at the University of Findlay. And it's my pleasure today to get a chance to interview Mr. Brian Moynihan, and I'm going to allow him to introduce himself so that you all know who he is. This is being recorded so that you, my students and alumni, and anyone else who is interested in the field of health informatics can just kind of get a little bit of an insight as to what the field of health informatics is all about, and certainly to showcase some very unique technology that's out there in the healthcare field that will allow you to get an even broader insight on the field of healthcare and how it's growing through the utilization of unique technology. So Brian, would you introduce yourself, please?
Hi, thanks for having me. So I'm Brian Moynihan. I'm the head of health technology and informatics at UNC Chapel Hill. And I work in the libraries, so I should preference that I'm at the Health Sciences Library at UNC Chapel Hill. I also teach a class in informatics as well, which is sort of a survey class for schools across North Carolina, so Duke University and Wake Forest and UNC Chapel Hill and a couple other places are part of that. And so that's been interesting to me, see a broad scope of everything across informatics as well.
Nice.
So yeah, that's me.
Great. Well, thank you so much for coming. I know you and I got a chance to speak over the phone, and certainly when I took the time to actually kind of start, looking up some information, I was like, wow. We actually have a new faculty member on board, and when she saw that you were coming today, she was like, why are we not a part of that? I said, oh, we are.
Oh, nice.
I was like, oh, we are. I said, and we're going to get a chance to talk to Brian as well as to be able to interject with her. So I have just a few questions to ask you in regards to the field of health informatics. My students have kind of asked me some of these same questions over the years that I've been here at Findlay, as well as even some of the faculty and staff. When I first came on board, I was challenged to come up with my own definition of what health informatics was, and so backing that up with some great relevant resources that we use from industry, I actually came up with my own, and it really kind of fits in. But I know that my students who have heard me lecture and give out that information time and time again would love to hear your perspective. How would you define or describe the field of health informatics?
Well, when I think about my own position, so I'm head of health technology and informatics at the library, I think about first principles. So I go back to there's technology, and what is technology? It's hardware, software, and data. And so traditionally, hardware was a server. Software was a program we ran on that server, and data, was something that came out of it. But that sort of expanded over time. Now we think of hardware more broadly, and so we think about it as it's not just a server, but it's a computer, it's your phone, it's this device that's on my wrist. It's all kinds of different things. And software also is not just things on your PC, but obviously on your phone, and it's running everywhere. You can think about software as being artificial intelligence that runs on top of things, and machines finding statistical patterns and making meaningful inference out of that, and controlling things that we do, and then all the data that comes out of that. And so traditionally in the healthcare setting, the data has come mostly through, like, back in the day, there would be a lot of paper forms in clinical trials, or there would be paper medical records.
Right.
And then when we started to see electronic medical records, you started to see the growth of payment systems, billing, and how do we make sure that we get paid for all of this stuff,
Right.
which is a totally different way of looking at things from the perspective of health. And I think that as the field has sort of grown, you see this shift over time, especially since 2008, when there was a lot of money poured into making sure that a lot of medical records came online, and then that was like this mad rush to get that done, and so a lot of things were left behind.
Right.
But the field of informatics in general, in my opinion, if I were to go back to times I've been to the American Medical Informatics, AMIA, conferences, a lot of it has been very much traditionally focused on electronic medical records data. And that is largely structured data. And then over time, the evolution of that, you're seeing more of unstructured data, and you're seeing a lot of data that did not originate inside of a hospital setting.
Correct.
And I see the expansion there. So my definition of informatics is broad, but it basically has to do with using hardware, software, and data to improve health. And there's a range of ways you can see that. So you could see it in public health. We've seen people using information for clustering in pharmacy to find new molecules. So that's a form of health informatics. You can use sort of Lean Six Sigma process improvement and look at the range of ways that things happen in a clinical workflow and how that can be improved as being part of informatics. And certainly, you've got biosurveillance, things like that. We're tracking the number of people who have flu, and then running that data, and then all the really interesting ways that it can be mashed up with geographic information system data that you could, look at neighborhoods and what kind of coverage they have. And so it's a really exciting field to me, but it is very hard to define, I think. Yes. So you get to these traditional sort of, what is information science? It's search, it's databases, it's data standards, and all these things. But I think for health informatics, applying those things usefully to health maybe would be the most succinct way I could think of putting it.
Sounds good. You hit all the key factors and all the key pieces that we pull out in our program, in which we are enlightening students on, strictly on a course by course and certainly day by day basis.
Yeah.
And so it is kind of difficult to define. I don't like to ever limit that particular definition, but you did an excellent job. So I hope you all were listening.
Oh, thanks.
Yes.
And for students at home, I'm talking directly to you. I wanted to say that you should, when you listen to me or anyone else, you should get a sense of think about critical thinking and debate that, and say, he really missed some critical component, and that's actually what I want to do in my career. And, that's great. You should do that.
Exactly. So I have just a few more questions for you. One of the terms that I like to utilize in kind of helping students to get a visual of what type of job or job area, I typically tell my students don't focus so much in on the job title, but focus in on the job description itself. I want them to read that in order to really get a sense of, is this something that I really want to do within this particular field? I've been using the term health informatics specialist, but another nice term that's out there job-wise too is health informatician. So what types of jobs could you tell my students that once they graduate with a Master of Science in Health Informatics, what are different types of jobs that you've seen out there that they would have access to?
At UNC, and I don't know if our student makeup is the same as yours, but we get some people who are coming in with a health background already, and they don't really have the technology and informatics part of it. And we have some people who have a technology part, but they don't so much have the health side of it. And so often I think that defines their academic career, that people are sometimes coming at cross directions and learning from each other.
Right.
And then coming out and definitely the course that I teach, one of the things we always do is an informational interview and say, and I say, this course is about you. And when we do write-ups of the lectures and I say, this write-up is about you. And we do final presentations and I say, this final presentation is about you. And I want you to think thoughtfully about what your next career step is, looking around at the sort of positions that you think are interesting to you, reaching out to the people who are in those positions, and then interviewing them and showing that it's gone through your mind, that you've actually processed, you didn't just, we do this informational interview, but it's not like question, answer. It's like people write up their reflections and how it changed them. So that being said, I think, certainly a lot of these people could go and work in hospital settings and work some part of, doing reporting and be tied to an HR setup, et cetera. But they could go into public health. They could be working with more public or broad-based data sets. There's a lot to be done with preventive health. They could go to work for an insurance company. So they're increasingly doing very much with data, and they are craving these people coming out. It's it's actually a very nice field to be in because it's such in such high demand, and it's in high demand because it's so valuable. Because these are the people, and I'm in favor of all the students who are doing this, because these are the force multipliers. These are the people who are taking a small effort and turning it into a much bigger effort, and so it's well worth hiring them. And I think people are seeing that around. A couple other areas I think people can go into are research, and so clinical trials organizations or clinical research organizations, nonprofits that get money from the NIH and such. They can work in research positions, and then also in startups. So increasingly you're seeing entrepreneurship in this space, and it's it's definitely a place where startups are going to change things in a lot of different ways, but that's a tough road to go for. I think for at least for the entrepreneur, but certainly these companies are going to need more and more people with these data skills and practical healthcare understanding and understanding the sphere. One of the reasons that healthcare is so difficult is because there's so much regulation, because if you get it wrong, someone can die.
Correct.
For so many reasons. So somebody who has a pretty good understanding of how it works, and even just the payment, is a big deal.
Right.
We say I've worked with a bunch of health startups, and when people start, they have this idea, and they're like, I have this great idea, and it's going to help the patient, Well, it's like, well, the patient doesn't pay for it, and well, okay, the physician. Well, the physician doesn't exactly decide. It goes to the administrator. Well, the administrators can only do what they get reimbursed for, so we have to take it back up. And so there's so much complexity in healthcare that it's a hard thing, and you need somebody who has been exposed to the broad scope. And then I think this, these health informatics programs are kind of compacted experience. So it would be great if you had 10 years of experience previously, but you can kind of get 6 of that by going through a 2-year program.
Exactly. I totally agree. You mentioned about public health, and we got a chance to talk a little bit before the interview even. The public health is one of those subspecialties of health informatics that I see really, really booming. For me, it's booming again.
Yeah.
Because I can go back far enough to be able to say that, I remember when, there was no way that you were going to not, interact somehow as a person within the community without your public health support.
Right.
And so now we're seeing that on the boom again. Knowing that in regards to subspecialties, what's your take on how health informatics can either better encompass or is currently encompassing the public health sector?
Our public health at UNC is broken down into various different divisions, and so some people are more health policy and management and thinking about the regulation side of things. Some people are more health behavior and thinking about apps and devices and things that can change individual behavior. Some people are more epidemiology and they're thinking on a more global scale of how these things happen. There is certainly a different view of public health if you're going to low resource countries where they don't really have a lot of technology, and then it would be in an American setting where that completely changes things. But in all these ways, the application of data to improve health can be done, and I think that certainly there's a lot of overlap between those areas. And to me, it's a really rich and interesting area. I've gotten in what I call my digital health device collection at the Health Sciences Library, and I'll show off some of the devices a little later on. But we have a number of devices that are consumer devices, things that could only be done previously in a laboratory setting. Things like brain waves with EEG or continuous heart rate tracking and things like that. The Apple Watch will test for atrial fibrillation and knows if you've fallen down. I mean, these are huge things. My definition of digital health is if you imagine this like blue sky and this little hospital right here, all the traditional informatics information had been in that little bucket, and now it's the blue sky of everything else. Like 99.9% of medical information and medical stuff happens outside of the hospital. And so this is a way to empower patients to understand their own care. It's a way to bring down costs. And so it comes with its own set of problems, absolutely as well. For instance, doctors don't want to be inundated with all this data and they don't know what to do with it. Or sometimes like a heart rate tracker is of low quality and so you're not getting the information you need. But I think that, the public health setting is an exciting one that's interesting to me. And I'll show off a couple of devices if you're interested.
Exactly. You did bring some very interesting ones, some that I've seen before and some that I have not seen. Would you mind introducing them and showcasing them to my students?
Sure.
You guys going to get a treat out of this, trust me.
So the first one you've already seen, it's on my wrist here. This is a Pokemon Go. So this is a wearable that you, just by hitting this button, it has a little blinky light and it blinks in different colors and you can catch Pokemon with it. And so this seems silly, right? But I started playing Pokemon actually because of this wearable and because it is this, makes many people change their behavior. It's made millions of people go outside and play around with their friends. And just like Fitbit is like encourage people to get more steps.
Right.
And then so if you want to understand gamification, if you want to understand behavior change and how you get change management, how you get people to do things that they wouldn't otherwise do, you should look to the masters. And the masters are games like Pokemon Go. And so what do? They give you these challenges that sort of scale up. So it's easy to get through level 1, it's a little harder to get through level 2. They give you multiple different kinds of challenges. So things you could do a little bit of this and a little bit of that. And people are kind of self-directed, and it keeps you kind of hooked. And so that idea of that unfortunately Silicon Valley has used lots of testing and intentional ways of getting at dopamine and hooking people on their products.
Right.
So you sit there and mindlessly scroll through it and look at all their advertisements. You can use a lot of these techniques to improve health. So for me, this is a behavior change device. It's also exciting to think that for $30 you could get something that connects to your app.
Yeah.
So I love the idea that you might have something on your wrist that a nurse on call gets a blinky light that's, different colored lights mean different things, and you could tap or double tap depending on the answer to what you're trying to come back. So this is one, and most people would not consider this a health device, but I wear it and I'm excited about it. One of my favorite ones is this. This is the Muse headband. And so it's a $250 headband that anyone can get, and you bring it to your phone, you put it on the back of your head like this, and it connects with 4 points of EEG. So EEG, electroencephalogram, or graph, I guess. And so you get 4 points, 260 times a second, alpha, beta, gamma, delta, theta waves for each of these things. And what I love about it from an academic point of view is you get all this data. You can just create apps with it. You could use this as an input device to something.
Nice.
So this is, it comes with an app that trains you on meditation. And I think that there are sort of two, it's hard to find a panacea, like drinking enough water is a good idea, lots of vitamin C, but I think that the two for health that would improve almost every condition are getting up and moving around more and being more mindful.
Right.
And so like a Fitbit is a case of getting up, having people move around more.
Right.
And actually there've been studies that show that people in the hospital with like almost every single condition in the hospital, with the exception, I think, of moms who just had a baby, who usually should rest more than they do. People should be up and moving around more.
Exactly.
And it's good for your physical health. It's good for your mental health.
Right.
And most of the diseases that we have in society in America today are a result of stress. You've got hypertension, a whole series of things that come out of that.
Right.
So people becoming aware of their own biometrics is a way of promoting health. And then it's exciting too that you can think of, and I created an application that is a virtual reality application that you actually control with your mind. So you can visualize dots coming out of your mind, or you can control a fire that goes up and down based on your brain waves.
Right.
And we did another one, and this one didn't work so well, but it was experimental, of actually thinking the word up or thinking the word down and using that to control a game where you're flying up and down.
Wow.
And so, it was an
Nice.
experiment for us, but you can imagine somebody who has locked-in syndrome, that they're conscious, but they're not able to move any part of their body.
Sure.
And then are all kinds of people with all kinds of conditions that could be helped out by this. People, kids with ADHD who have lack of focus could play a game where this controls the game, and if they're off focus, then they're not paying attention.
Right.
So this is one of the ones that's exciting to me.
Nice.
This one is the Spire. So this is a little Spire stone, and it's a respiration tracker. And the way it works is you can kind of squeeze it a little bit and feel that it is tracking the ins and outs of your breath. So you put it into your waistband, and it does a pretty good job. And you can look on the app and watch and visualize. And it kind of walks you through a breathing exercise. And again, breathing is one of these things that it's free. We do it all the time, and it can improve all kinds of health conditions. So this is kind of a nice one. And what I like about these devices too, and here's another one called the PIP that sort of exemplifies that. This is electrodermal activity. So you hold it between your fingers like this, and there's a very, very small magnetic charge, electric charge that you're not feeling really, but it's getting at your level of stress at that exact moment.
Okay.
And so you can track it and watch how it's moving over time. And if you're tracking this, and you can watch in the app, how meditation can help that out, or you can see why am I stressed out on Tuesday mornings and Sunday evenings, and then try to find a pattern in that. And what's cool about this too is that it's a platform, so you can take this and build a whole series of apps around it. So people have done these really fun and ridiculous apps, like one you're flying a spaceship through these like crazy psychedelic patterns in space, or another one you're meditating, or another one, all kinds of different things you could do, or just visualizing the data. And people being aware of that data, that sort of graph literacy, like the ability to look at data and graph it and see what it's doing, I think that's also really inspiring, and I think something that, 200 years ago, we didn't even have a way of communicating this stuff, even if you were a scientist in many ways. And now, like, everybody has it. Like, everybody knows on their phone, has an indicator light of exactly how much, power they have left or something like that. And so even new methods of visualization, new ways of getting ideas to people in clear ways can make a huge difference too. So usability of these products, both the physical usability. I like these ones too because they're rugged.
I want to make an antiquated, a very, very old comment that as soon as you started describing this, can I say that this is the new electronic and totally cool mood ring? Can I say that?
Yeah, actually.
If I say that, will you know what I'm talking about? Because y'all might not know, but I know you and I know, right? Yeah. So we couldn't record what all was going on, but we had the colors memorized. When we wore those things. And so this kind of reminds me of that, but just so technology advanced, right? That everybody is into apps, and everyone is certainly into utilizing them more and more as part of their daily life. And I think that's where the consumer demand for products like this certainly do come. It's the reverse almost. It's not so much physician and medical driven as it is consumers are saying, hey, look, I want, I need, I'd rather have, and no, I'm not going to use it if it doesn't have this, and so forth and so on.
Right.
Very good.
And they start to understand, this is my data. I mean, we ask the question, whose data is this? And it's like, well, is it the electronic medical records company? Is it the hospital's data? And my answer is, it's your data.
It is.
And I think that we've had a lot of struggling in the industry with sharing data between, because there's no monetary incentive for one hospital to share with another. And so then there was a lot of like HIE talk about the health information exchanges. And then like in North Carolina, for instance, they're like, okay, it's the law, everybody has to give it to the government. And they're like, this is unfunded and we're not gonna do it. And so basically it didn't happen. And I think that happened at a lot of different places. Some were more successful than others. But I think to me, one of the big steps has been the development of FHIR, F-H-I-R, Fast Healthcare Interoperable Resources, which is just using all these modern technologies. It's using JSON, which is a standard data format that everybody on the web knows how to use. It's using HTML, CSS, JavaScript, and it's using little micro ways of tapping in and only being where it needs to be. Not this one giant solution for everything, but people finding all kinds of ways of getting data out better. And it's, I mean, people, you're talking about this consumer demand. I'm sure your students are coming in and like they're used to doing all this stuff, and then they realize, really? Like they're faxing PDFs to each other? Like that's the state of the industry? Like that doesn't make, but also I think tied into this idea of a personal health record, people have been talking forever about owning your own data and stuff, and we haven't really seen it. But to me, when Apple stepped into the game and started working with like, I don't know how many hundreds of hospitals across the country and said, we're gonna have a way to dump all your information into your Apple Health app via FHIR using FHIR, that was huge because here's like a major step towards this sort of stuff happening.
Exactly.
And I'm wondering, and it's an open question I think, but I think it's definitely gonna affect things, how Silicon Valley, Apple, Google, Amazon, Microsoft are gonna start shifting the game a little bit.
Exactly.
And a couple of technologies that are interesting to me there, I can send a link and pass it on to your students if you want, but Microsoft has this technology that is essentially a digital scribe. So two people have a conversation, and then it's getting the whole thing, and it's recognizing whose voice is whose, and is able to track that. And that's one column. And the next column is pulling out all the information that's relevant to a certain category and putting it into a middle column. So we talked about smoking, we talked about family history, we talked about whatever, and those things get sort of categorized in the middle. And the third column is suggestions of things that could be dumped into the electronic medical record. So it's like, here's the stuff, and then here's where we talked about smoking, and then here's this person should maybe some suggestions for what that person could say, the doctor could say. And the doctor can search on the transcript, correct what it says, use some of the comments, add in their own stuff, and then they hit a button, and then the magic dream is, it goes into biosurveillance databases, it goes into the EHR record, it goes into clinical registries, it goes into everything from there. But to really using the technology to extend what people do, it's not that a robot is going to replace a doctor, it's that doctors are going to be inside this massive robot and be much stronger than they ever were before. And it's also that doctors are going to be working to the top of their license, doing things that only doctors can do. Things that specialists used to do are things that now primary care physicians are doing. Correct. And things that they were doing are things that nurses are increasingly doing. And things that nurses used to do, like weigh you and things like that, are increasingly front desk staff are doing that. And things that front desk staff used to do, like check you in, the patients are doing themselves. And so technology enables all those things at all those levels. Right. And it's basically the only thing that is even possible to solve our coming healthcare crisis. It's already 18% of our GDP and rising. Like, if we want to have anything else other than healthcare, like education, like roads, then at some point we're going to have to bend the cost curve. Right. And we've got this, this huge aging population who are living at home, and it's great if we can keep them living at home, because if they come into other places, it's much more expensive and difficult. So anyway, those are some of the things that are interesting to me.
Exactly. Me as well. I do see technology as that wonderful, wonderful vehicle that is just purporting healthcare as we knew it into a much more faster and streamlined, and certainly more accuracy, and being able to have that great HIE, that health information exchange, to where if something's already been resolved and found out, and or a great medication or a great treatment for a disease has already been discovered, then it can certainly be transmitted a whole lot easier now, and certainly faster, from point A to point B where it's actually needed. And that entire concept of utilizing, the information and getting it disseminated to all of the varying areas that it needs to go to very, very quickly. It's not that we weren't disseminating this before. It's just that it was on a much slower pace, and unfortunately, by the time that the information got to, to where it was actually needed, then of course we didn't see the healthy outcomes of the patients that we were treating, in that particular time frame. So I do see technology as being that great vehicle, and I think that was one of the reasons why I was so passionate about this particular program, Health Informatics, because while on the one end we're looking at everything being mandated, on the other end we're looking at, again, bumping everything up to meeting, consumer demand, and also to be able to, engage patients more in being more concerned about their own health. Where, people, wear Fitbits. I wear mine every single day, and I'm always amazed as to what it tracks, and even the trends and so forth. And oh, I didn't get all my water in. It's like I feel guilty that I didn't drink, all of, everything that I needed to, or stay within whatever calorie intake. And so what's happening, I'm taking over then more and more responsibility for my own personal health. And I do think that technology, again, just has such a big play with that. And I want my students to be able to just be energized and excited about it, and decide what aspect and what part of healthcare field do they want to be able to kind of go out and make a change, in the world, because HIE I don't just see as being for the United States, but also then globally. So we want this great exchange to be global. So I thank you very, very much for sharing all of that. I think I know my students are just going to be thrilled when they hear the video and get a chance to see, someone other than just Dr. Bradley talking about, how passionate. get a chance to meet a variety of different types of students from different backgrounds. So my mood ring students are going to appreciate this video, and my millennial students are going to appreciate this video. So it was very, very, very helpful. So thank you again so much for coming to Findlay and doing this with us.
Thanks, and you've got my email address, so people can reach out to me too.
Exactly, exactly. Thank you. And so I hope you enjoyed this video clip, just giving you another insight on health informatics. If you're interested about the Master of Science in Health Informatics program and you have not yet contacted me, shame on you, but this is how you can contact me. My email address is Bradley, B-R-A-D-L-E-Y, the letter L and then the number 2, at findlay.edu. And again, Brian, thank you so much.
Thanks very much.
Have a good day.